So we're going to have our client lay on his belly, and he's just going to bend his knee. So I'm looking as he bends his knee, is he able to keep his back still? He's going to lower his leg again. He's going to try that again. I'm looking at his pelvis, I'm looking at his hip. I'm hoping that he can bend his knee without other compensation. So I see that he's able to do that. He's going to relax his leg back down. That's what you want to see. That means that the stiffness and the integrity of the core is enough to compensate for any stiffness in the front of the hip. But let's pretend that he has a lack of awareness of engaging his core and or stiffness and overactivity of his hip flexors and iliopsoas. If that was happening, what may happen is when he bends his knee, his hips are going to rise up. And then when he relaxes, of course, it's going to come down. Another thing you might see is he's going to bend his knee, his hips are going to rise up, and he might even have a tilt of the pelvis and relaxing down. So you can imagine what might happen to someone is every time they bent their knee as they were running or doing a lunge or doing any deep knee flexion, squats, if they weren't able to integrate their core and keep that stability there, that they might have some overuse and dysfunction in the lumbar spine to compensate for the stiffness in the front of the hips. Try that and see what you